Hi viewers, welcome back to Dr. Ram's Coding Academy. Now we are going to see about the global modifiers. I hope you would have seen our previous videos on the global surgical package or the global surgical period. Viewers who haven't watched those, please watch them so that you'll have a fair understanding of what exactly the global surgical package or the global period is all about. Because when a patient is going to present to a hospital or an office, and this patient has already underwent a surgery, whether it is a minor surgery or a major surgery. And if this patient visits the clinician might not be reimbursed for the service that he rendered. This concept is what we say it as the global surgical package, as a patient is still not out of this global postoperative days. I have seen certain practices, you know what? When a patient comes for the suture removal, normally the suture removal is included within the global period. So usually they remove the sutures within this 10 days. But some practices might do this on the 11th day or the 12th day so that the physician can charge his patient with a 9 into 11 or a 9 into 1 2. But this is not ethical. Though the patient is out of the global period, but the service is still considered as a service that is related to the previous surgery. Due to administrative reasons, the patient might be asked to come on the 12th day. In that case, also, the provider should not bill the service separately as a 9 into 1 2, but this qualifies only as a 9 into 2 4. Now, what if this patient is turning up for a different condition that is nowhere related to the previous surgery? Or what if this patient will have to undergo a procedure in an operating room or in a procedure room? In that case, will that service be reimbursed by the insurance company? All of this can be known only if you understand the usage of the appropriate modifiers during this global period. So we all know that the global period, it begins with the surgery and it lasts for a particular period after the surgery. And that we have distinct global periods as preoperative, intraoperative, and postoperative. We also know the global days for minor procedures as 11 days and for major procedures as 92 days. Minor procedure can also have a 0-day global. Now let's quickly run through the modifiers that we can use when a patient is within this global postoperative period. It depends on the type of service, whether the physician is going to render an E&M service. In that case, we can use modifiers like 24 and 57. If it's going to be a post-op surgery complication, then in that case, we need to think of 58 or a 78 and a 79. Now, when will you report a 58? When it is a 78, when it is a 79, we'll discuss elaborately in a separate video. Because the medical coder and the medical biller will have to understand the meaning of each of those modifiers because these can cause significant impact for the provider who has rendered a service on a patient who is within the global postoperative period. It is not a difference just with 5-8 and 7-8. There is a tremendous difference on the usage of these modifiers. If you really understand the usage of modifiers, which actually reflect the deviation in the circumstances or which reflects a change in the patient's condition, the type of treatment that the patient has been subjected to, there is an alteration. If you understand that completely, you can figure out the holistic picture of this encounter. And medical coders who are taking all these examinations should have a strong understanding of these concepts of modifiers, especially the global modifiers. And we also have the other surgery modifiers as 54, 55, and 56, which we will deal with separately. Now, what is the need for these modifiers, especially the global modifiers? Now, if you don't use these modifiers, the claim will be denied. It's an outright denial. As said in a previous video, that once a person has underwent a surgery, and if he is going to be an insurance patient, then the payer systems would actually have an alert stating that the patient has the global days for these many periods. Imagine a person who is undergoing this surgery on this July 1st. Then this person is bound within this global surgical period for 3 months. So, roughly August 1st, September 1st, or the September 30th, till the September 30th, now the patient is within the global period. Now, during this period, if this patient undergoes any service or any procedure within this 90 days time frame, then the payer system will be alerted because we are sending a claim and that the patient is already within the global period. Sometimes I have seen also softwares also being organized in such a way that if a patient has had previous surgeries and if you are going to report a service during this period, then the software would give you a signal stating that the patient is within this global period. But it is always expedient that you verify. You will have to literally go back, see the CPT codes. Sometimes it becomes very cumbersome. Now imagine there is a patient who is having a treatment with a particular provider and the doctor does a treatment and this treatment gets denied. Now what you will have to see is that you will have to go and literally verify all the services or all the previous date of services which this patient has had, and you will have to see what are the CPT codes that are being reported during this entire period of 3 months. So you will have to go and review all those claims and see if those CPT codes have any global period or not. Imagine if a major surgery is being done within a time frame and this particular visit falls within this global period, you need to literally calculate how many days are within the global period and on which date of service this encounter falls. And if this encounter falls within this global period, then you'll have to use the appropriate modifiers. Sometimes it becomes very cumbersome for coders, especially when I have had coded surgeries. I found it very difficult because I was working for an orthopedic surgeon. Patients would also get treatment even after the post-operative period is over. When the post-operative period is over, then there is no problem. Then we don't have to think about the global modifiers. You'll have to think about the other pricing and informational modifiers according to this medical record. So when I have to code, I will have to go and check all the previous dates of services and see which CPT codes are which global periods. So you'll have to go and check in your software what are the global periods for those CPT codes. So to code one claim, you'll have to go back to all the previous claims, and this would certainly cost so much of time. But your managers or your team leaders or your management might not understand this problem. So it's better you talk to your managers or your team leaders because I have experienced this and I know the pain of checking everything. So what I used to do is I used to maintain an Excel sheet for every patient. I used to write down all the date of services and the CPT codes and when which surgery was being done and what is the global days. So that when we find the new encounters, now I can easily figure it out whether this patient is within the global period or not. It is an extra effort. It is an extra work which you need to do so that you can finish your work quickly. Because you are actually going to go for one claim, but that will not be done unless you go back and visit the entire visits during this 90-day period or 3-month period. Now let's see a coding scenario. Anuradha had an RF of left radius last month and now presents with severe abdominal pain for which the physician does a complete exam and prescribe meds. You can see the patient, she has underwent an RF, and RF is nothing but an open reduction and internal fixation. Essentially, she has had a fracture treatment and the global period for this surgery would be 90 days. So it is considered as a major surgery and so there will be a post-operative 90-day global period. It is stated that the patient underwent the surgery only last month and now she is visiting the office for an abdominal pain. Now the abdominal pain is in a different body region. Now whereas the fracture was in a different body region. So in this way we can consider that this abdominal pain has no correlation or has no association with the previous surgery, as the surgery was on the left radius. In this case, a doctor examines the patient and prescribes medications. So you can very well report the EM code 99213 because she is an established patient. And you can also report the diagnosis code for abdominal pain. If you're supposed to send this claim with a 99213 or a 99214 according to the extent of documentation and report the DX code as abdominal pain, the claim gets denied because you haven't used the global modifier. You will have to use the global modifier 24. 24 refers to the unrelated EM services during the global post-operative period. Only when you use this modifier 24, the claim gets paid. Otherwise, the claim will be denied. We will talk about all these global modifiers. I will create separate videos on each of those global modifiers so that all of my viewers are watching, all of the medical coders and medical billers understand the meaning of each of those modifiers so that you apply these modifiers in the proper settings and you can get the payment immediately right away instead of inordinate delay. You don't have to keep it as pending under denials for this global concept. You can very well process the claims with ease so that you can keep your customers also happy. So your knowledge will definitely help your own selves as well as the providers and indirectly the patients whom the providers are treating. Because we should not end up with timely filing of claims and that shouldn't be a cause of pain for the providers. I hope this session is useful for you all and I will be making many such videos on the global modifiers. So keep watching our videos and please post your comments or any clarifications that you have. If you want to have the training for any of your friends or any relatives or your near and dear ones, please reach out to Dr. Ram's Academy. Our CPC training is also happening in the weekends. Thank you very much for watching this and I'll see you in the next video.